Okay. Cool. Hello.
Hey, how are you?
Waiting for a few people to join us as well.
Cool. I'll just give it 5. How's your day been?
Pretty chill.
Yeah.
Went to the doctors, got some blood test requests and that sort of thing.
Were you in the clinic today?
Whoop.
Oh, can you hear me?
It was a clinic day, but yeah, it was a bit quiet, so I stayed at home.
Oh, cool. Yeah, sweet. Happy
Oh,
days.
you're breaking up. Is that better?
Is that better?
I think so. Not skipping anymore.
Are you hooked up to Wi-Fi?
No, I just turned it off.
Yeah, okay, cool. I'm going to do the same.
Better?
So we're both off Wi-Fi?
Yeah. Yeah, hopefully that makes it a little less skippy.
Cool.
Cool.
All right. Well, you start if you want to.
Not really, no, but okay. So we're doing a big talk about endo and like herbal treatments, nutritional treatments, all sorts of things. But we'll start off with what it is, because why won't you just stay still? Not everyone has a good understanding of that. So it's more seen as a hormonal condition, but it's actually, sorry, that's just annoying me, actually more like inflammation driven that affects hormones, not per se hormone driven, if that makes sense. But yeah, so it's when endometrial tissue, so the lining of your uterus essentially, grows outside of your uterus, and that has estrogenic effects and drives a lot of the inflammation and pain associated with endometriosis. So like pain upon having sex, pain with your period, pain not with your period too. But yeah, apparently I found some stats on it too. So around 10 to 15% of women menstruating currently have endometriosis, and around 80% do experience the variety of those pain symptoms, which is interesting. Yeah. Did you have anything to add about that
it is
one?
interesting. Yeah, I just I think a lot of people, obviously most people jumping on probably know essentially like in
what it
a
is?
more basic form what endometriosis is. Yeah. I think some of the big common symptoms, like you've already mentioned, definitely, but I kind of sat down and listed some more uncommon symptoms as well. I think endometriosis in the last couple of years has exploded in terms of like I think mainstream understanding. There's mainstream understanding of endometriosis, and then there's what we're starting to actually learn about it as this, like you sort of mentioned, this systemic inflammatory condition. And so I thought some of the more less common things that I've definitely noticed treating endo over the last couple of years and becoming very familiar with it myself in clinic is some of the other things that I think, that people just always think if you've got heavy periods or heavy painful periods or pain with sex, like you sort of mentioned, they're the main things. But I listed some of the other things that I definitely find, I feel like maybe at some stage, or even just for anyone listening, could be also things that if you have ever questioned whether or not you have endo, but you kind of been maybe dismissed by your GP, these are some of the other things that I definitely have noticed, because I've definitely had some clients that have got what I would call asymptomatic endo. So they don't tick the current diagnostic criteria.
Don't have those typical symptoms,
typical signs and symptoms. And for that reason, that's quite often not diagnosed until later down the track, or like too late when they're trying to have babies or something like that and they haven't fallen pregnant. Sorry, my dog's about to go gangbusters. Go outside, you psycho. So one of the big ones I think is infertility. Or fertility issues. So if you
Yeah.
like, if someone has been trying for ages to have a baby and, you know, they do kind of get moderately heavy painful periods or painful periods, I think endo is worth investigating 100%. And most good gynos will start to look into that. Family history, I think, is important too, like understanding what the other women in your family have been through from a period point of view. Like, did your mum or your grandmother also suffer, or your mum's sister or your sister, you know, also suffer from heavy periods? Did they have hysterectomies young? Like, there's all these things that we now know that have probably been treated differently over the generations, that probably could have been endometriosis or some sort of estrogen driven condition that probably could have really been helped with holistic interventions.
Yeah.
I think some of the more asymptomatic stuff, so just what someone says is a heavy or a painful period for them. And I think I also really, really think people's definition of pain and threshold for pain is so different. And, you know, what I might think is painful, like I've got a super high threshold for pain. So what I might think is a normal painful period, you might have and, you know, be doubled over. So I think questioning around pain and painkillers around the period and things like that is also important. I listed PCOS as almost like a coexisting condition, because it's not all the time, but some of the time definitely PCOS and endometriosis are diagnosed within a couple of years of each other, and they're both obviously inflammatory hormone conditions. And my last one I wrote a page on this when I was sitting here before.
Oh, I've got my notes here too. Yeah.
I'm like, I feel like it's such an important topic that I don't want to miss anything. The other big one is gut issues. Like when we're talking about endometriosis that hasn't been diagnosed, or you know, is in potentially endo that has been diagnosed, and let's say the lap surgery was years ago, like a lot of people, and there's so much research that's coming out about this now too, a lot of people experience, and majority of my endo clients have gut issues, and they've either had gut issues for a long period of time, or they've got gut issues that coexist with the endo. Like SIBO is a big one as well. So yeah, there's heaps of cool information that's coming out about like even the health of your gut microbiome in terms of lipopolysaccharide production, certain bacterial clusters and classes of bacteria that have, you know, fit into that kind of estrobolome sort of category. And yeah, so I feel like there's common signs and symptoms, and then there's all this stuff that can coexist with it as well, or just other things to look for. So
yeah. For sure. And because that tissue does grow in like funky places in your abdomen, you could have it like growing on your liver and experience like predominantly liver symptoms or something like that, or just back pain in general.
Yeah, exactly. And even just gut pain. Like how many clients have you had like where, you know, you've been treating them for gut issues, and yes, they have gut issues, but you clean up their gut and then they get diagnosed with endo, and when they have their laparoscopy and the endometriosis surgery, or endo is confirmed and they do the surgery, some of those like residual gut issues go away over time once that heals as well. So I think, I think it's really interesting. Endo is so hectic in terms of how multifactorially it can affect like the human body. It's epic. So
definitely.
Well, should we jump into? Oh, sorry. Yeah, you go.
Yeah. So when you said laparoscopy, that is like the gold standard in diagnosis as well. I don't think they do they still use ultrasounds and stuff before moving past that, or?
I think that like usually an ultrasound's usually being performed, but maybe not for endometriosis investigations. It's usually maybe, and then
PCOS investigations and such too.
Yeah. Most the general understanding these days is like in the sonography world, and you know, even like with dealing with endocrinologists and gynos and stuff like that, is that ultrasound shouldn't, or most likely will not, pick up endometriosis. So yeah, you're 100% onto it. Like laparoscopy is the gold standard for diagnosing it. So should we move on to obviously where we can step in from the preventative health space? Because I think like there's obviously with endo, there's obviously diagnosis, which we've covered. There's what it actually is, the treatment The medical treatment is surgery. So obviously that goes in via excision, takes away a lot of all that, you know, the lesions and all that, you know, extra tissue, and frees up the ovaries if they've been tied to the bowel, and all the horrible, crazy stuff that can happen with endometriosis. So surgery gets in and kind of, I always explain to my clients, surgery cleans up the space. It doesn't deal with what is actually driving the endometriosis. And that's where we want to get in and work with that sort of space. So from I guess like a pharmacological intervention point of view, like again, standard recommendations are to go on the oral contraceptive pill, have a Mirena popped in, or take, or sometimes just take progesterone, depending on when a woman is diagnosed with endometriosis and what stage of life she's at. But beyond that, sometimes, you know, and sometimes that's 100% great. Like some people will just pop a Mirena in, and that will kind of negate to a degree how the estrogen behaves in the body. But I have a lot of clients who would prefer not to do that, because obviously with any form of contraception, there's side effects. Contraception interventions don't always agree with people. So contraception or not, to manage endo, we can do a shit ton.
Definitely.
Cool. So let's start with some of your top dietary things. We'll start with like the dietary stuff before we get into like supplements and herbs. So yeah, you go, and I will add in extra stuff.
There's so many, and like a lot of them do tend to be somewhere between a food as medicine approach and more like you can actually prescribe this as a supplement. But I had a few that came to mind like immediately with the turmeric and your fish oils and that sort of thing. But also like green tea, and like all of those anti-inflammatory foods as well, because it's predominantly inflammation driven. So anything anti-inflammatory, taking away inflammatory foods, whether that's your dairy, gluten, or your processed oils and that sort of thing as well.
Yep, 100%. Like, and it depends on, like for everyone listening, it really depends on where you guys are at when you come to us. So if you're someone who really hasn't even considered dietary interventions to deal with, you know, your endometriosis, then straight up we're going to be looking at the big drivers, which is processed foods, high sugar or sugar intake in terms of refined sugar. Gluten is a massive one. I pull all of my endo clients off gluten, and because I think too, like the more we understand about endometriosis and how it behaves and interacts with the immune system, the more we're starting to really and should be looking at it as almost like autoimmune in nature. So we're kind of looking at generalized autoimmune, like sort of not generalized advice, but like gluten goes in autoimmune stuff. And gluten, obviously we've had that, you know, trying to think of the researcher's name now, but anyway, that's kind of basically said that gluten is inflammatory now for a lot of, you know, of those inflammatory autoimmune style conditions. So gluten goes. There's some cool research coming out for dairy as well. Like dairy doesn't have to be for everyone with endo, but I think again, that's where an individualized approach comes in. But there is some pretty cool research for like the A1 casein proteins now with dairy being inflammatory.
Yeah, I did see a bit of that today.
Yeah. You mentioned some awesome stuff like the food as medicine. So would you say green tea, turmeric, fish oils?
Fish oils, yeah. And also like your ginger, all your warming spices like that as well. Yeah. They all bring like antioxidants and anti-inflammatory agents to them.
Yep.
And they're so easy to chuck in like all sorts of meals.
Yeah. Like I think if you pull out your big inflammatory foods and you work out what they are for you, like, you know, obviously, let's just say gluten specifically, dairy. Then we want to look at some of the other big things like potentially eggs, potentially soy. But this is obviously, this is where, you know, it's case by case. Like I would never pull everyone that walked into my office off eggs. No way. Eggs are beautiful. They're such a whole food. But if they're inflammatory for someone, which we can, you know, talk about, then that's when we'd look at that. But I definitely just say like a good anti-inflammatory diet. So like what you sort of said there, like include all of your herbs and spices, brightly colored foods, antioxidant rich we want, polyphenol rich we want olive oils, avocados, just, green leafies I think are amazing because they obviously support a lot of that liver and estrogen detox through the liver. Yeah, I'm trying to think if I've missed any foods. I didn't write a food list. I'm like, Chrissy, you know this off the top of your head, but I feel like now I should have written some shit down. Nutritionally as well, I think it's really important to mention we can step in, and I think it's also looking at a lot of, and we're probably going to overlap with a few things here, but the liver and gut, and looking after the liver, like the phase 1 and phase 2 detox of the liver and the overall health of the gut and the gut microbiome have to be paramount when like looking after someone, well, with so many conditions, but we're talking about endometriosis. So obviously that's what we're going to say here. But your phase 1 and phase 2 and phase 3 gut detox of estrogen and other toxins that can drive up any sort of inflammatory response is so important. Hey.
Yeah, for sure. And that's pretty like, that's really easy to support with diet as well. So like, with your cruciferous vegetables and all that, that sulfur pathway, there's just so much you can do that's easy to modify in the diet. And like the foods that we were talking about and that kind of anti-inflammatory image kind of brings up how other people would picture the Mediterranean diet as like an easy one. And you can adapt that to suit the client or the person that you're looking at.
Yep. Yeah, no, it's so true. I love that the Mediterranean diet just shines through all the time.
Such a clear picture.
Such a clear picture. So yeah, all of those beautiful fats, brightly colored foods. I wanted to chat over supplements because I do feel like they're so important, but I don't want people listening to this to take all these supplements that you and I are going to discuss and these herbs that you and I are going to discuss and go, I have endometriosis, I need to be on every single one of these. Because again, treatment needs to be individualized. And also, you know, like not everyone has the same, like there's definitely the hormonal drivers of endometriosis, but then we're looking at a whole systemic inflammatory picture. So everyone's need for supplements and different types of the same supplements and different dosages of the same supplements is going to be different. So, but I did want to mention how important certain supplements are, specifically some of the food-based ones that you mentioned, like turmeric, beautiful, resveratrol, magnesium is just hands down 100% a must. And your good fats. What else? Did I write any supplements down? I don't think I did either. Oh yeah, zinc. I did zinc.
Yeah,
liver support.
Got that one too.
Yeah, N-acetylcysteine to really help like the liver's, you know, own anti-inflammatory response. Gut support if you have gut issues, or just obviously, you know, there's that component of it. Fiber, I know we're kind of jumping between, but fiber is so important when it comes to gut health as well, because you've got to think of, you know, a diet that is, you know, has a beautiful diversity of fiber is going to help carry out any of these, you know, toxic estrogen metabolites. So fiber, even as a supplement, like obviously we do use that because we work the gut so much in the clinic, but fiber from foods or supplements is really important. Have I missed any?
In terms of food as well, like there was a few extra ones that I had, like your flaxseed, which is a fiber, helpful as well, and also anti-inflammatory. I had a little bit about like your B6, your Bs, and then the rest kind of depends on what your symptom picture looks like, but other things that help with detoxifying estrogen, like your DIM or something like that. But again, it depends on the person.
Yeah, 100%. And even on that DIM note, I freak out if people just think they can go and take DIM willy-nilly. Because anyone listening, you cannot. You need to understand what your estrogen is doing before you are taking DIM. So yeah, and the Bs definitely. I think I didn't write that down, but Bs are so freaking important. Hit us with some herbs as well, because for anyone listening, like obviously we love the nutritional side of things, you and I and all of us in the clinic, and foundationally we use food as our absolute first, and then supplements over the top of that. But and you would be the same because I know you love hormones as much as I do. The herbal part that can overlay the food and supplement side of it when it comes to hormones, I think is just absolutely phenomenal. Like I freaking love what naturopaths can do in the hormone space with herbs. So do you want to just also hit the listeners with some of your like your faves for endo that, you know, go beyond food and supplement support?
Well, there's turmeric again. Your ginger as well, again. Some other anti-inflammatory ones that you can use, like your Nigella, that's had a lot of research popping up about it recently. It's also known as black seed, so there's you can get that on the shelf as well, but yeah, it's not gonna be equated to naturopathic Nigella extract. Your berberine, especially for gut stuff, but it's also anti-inflammatory. And then there's like, depending on the symptoms, there's a few different other ones. Hormone-wise, you can go in with like your Paeonia, your Vitex, other herbs depending on fertility issues. It really depends.
Yeah.
But then the main ones for like pain and reducing that inflammation and that, I want to say congestion in the uterine space and the uterine tissue would be like calendula as a lymphatic as well. You got your wild yam as well as a hormone modulator, crampbark, yarrow, motherwort, like all of those. They're so useful for cramps mostly, but yeah, if you do the right doses and the right combo, you can definitely make a big dent.
Yeah, I think that's so cool, and I think that it's so cool that even just within the herbal space, like you can target in the inflammation side of things, you can target the pain, the spasm, the actual like uterine congestion side of things. And I know like even for some of my clients that we are working with endo or suspected endo, or, you know, just really crazy periods where endo is not the actual issue, but sometimes even like different herbal bottles for different things, like herbs that were a bottle of herbs alongside obviously supplements and food, but a bottle of herbs that are anti-inflammatory for the entire cycle, and then some specific stuff that comes more in at the luteal phase, and then some actual more for people that are quite chronic obviously, and then some actual specific, you know, like what you just said, like pain modulating stuff right around the cycle when that's happening. Like like it's not just like a one size fits all, here's your herbal bottle for endo. It's, well, what goes on for you and where do we need to support that?
True. And I also did have some questions come up, and I put up a question box earlier today. There was quite a few. Led to some research for me. So yeah, there's too many tabs open, but I'll pop some brief things up if I can find them. There was a question around high bilirubin and endo and whether there was a relation between that. And I did find a little bit about like heme and that heme breakdown pathway. They suggest that it might even be a driving factor in the development of endometriosis. Have you read anything about that lately?
No.
No? Okay, I might send you that one.
Send me that.
But
I'd be so keen to know about that. No, because like I actually haven't even heard of there being a link between the two. So that doesn't mean that there's not, though, because far out the research in this area is exploding. So send me that one.
Especially if you're going, like if you do have sort of more severe or advanced endo and you do have those growths kind of edging upwards, you can get a lot of funky symptoms. And if you did end up with it on your liver for some reason, that would definitely mess with your bilirubin and other things. But yeah, that would be pretty dramatic. It's kind of like bilirubin that is like not late stage life high, but not like Gilbert syndrome or something like that, where it's kind of high, not as a kind of preliminary, more as a secondary to the endo. Is that what they're suggesting? Yeah, progressing towards that. I think it's more, it's hard to tell what comes first sometimes though, because you just kind of find people as you find them.
Yeah, no, send us the article on that. That'd be cool to read. What do you think?
Sure. Oh, and then with herbs as well, like there's all your immune modulating herbs with endo, which, you know, can be also anti-inflammatory. But yeah, it depends on the picture. And then there's all the gut stuff. Like there's too many pathways to go down.
It's a huge topic. What were some of the other questions you had come through?
Just trying to find it because I can't open it on my computer for some reason, and I forgot to screenshot them. If someone can comment them, I know you were watching. I saw your thing come up. What was it about?
Questions? The other thing we can do is you can if the questions haven't been answered, you can always just flick them up into your stories with the answer now that we've done the live, so that they are.
Yeah, I can pop that up.
Yeah.
There's just so many tabs open, and I don't know what I was opening them all up with.
That's all right. That's so fine. That's okay. Well, maybe just do the questions, flick the questions up into the thing. So, and people can obviously watch the live. And then if they do want any more information, obviously they can just like DM you. But yeah, I feel like
I think I might do a follow-up post as well.
Yeah, I'm going to definitely do
with some of the answers.
Yeah, definitely do one of them. IUD. Oh, we can talk about histamine if we want. Oh my gosh, who's got an hour? Yeah. So histamine and the immune response and endo is just epic. Jess and I have actually done a podcast on histamine. I can't remember if we talked specifically about endo, but we definitely talked about estrogen. But yeah, there's a huge relationship between your histamine response and your estrogen and how those two interact with each other. So understanding if you are someone who has histamine driven symptoms and working at that at a gut level, yes, but also just even like an immune modulatory level is really important with controlling the inflammation that comes with endo, and also how sometimes, to a degree, I suppose this is the right way to say it, but how aggressive endo can be so dictated by how your body deals with estrogen is probably the best way to say, not estrogen, histamine, sorry, is probably the best way to say that without, that's a huge topic on its own, that one, but something we could definitely chat about on a different live, I think. So.
Yeah, for sure. There's a lot to this, and it can go down so many different pathways. Yeah.
I feel like histamine on its own is like a half-hour chat, but it's a good question. Whoever asked that, because it's histamine and estrogen is probably one of my other fave things. I have a lot of fave things. They all seem to involve estrogen though. It's like estrogen,
all hormone related.
All hormone related. Exactly. So, well, let's wrap it up then, because we've done half an hour and time just goes. But basically, if anyone does have any more questions about this sort of space and this endometriosis space, and they are really looking for a practitioner to work with them, book on in with us. We love the hormone space. Obviously, Mickayla, you being a naturopath, you get that whoever books in with you gets the added bonus of herbs as well. But, but obviously, definitely, but primarily like food. I know you're such a little foodie and you're big on food as medicine as your your primary preventative treatment. So so if this is anyone watching this is like, yep, this is me, and I haven't worked with a practitioner from the holistic or preventative or just even a holistic point of view to work my endometriosis and see what else I can do diet, lifestyle, supplement and nutrition wise, hit us up.
Yeah, and I'll post this on my feed, and if you've got any comments, you can either DM either of us or comment on the post itself.
Yep, sounds good. Cool. All right, love. Well,
good chat.
I'll see you soon, hopefully.
Yeah, thanks for joining, everyone.
Thanks for joining, and we will see you soon. Bye.
Bye.